Hi, my name is Danko, and I did my K research fellowship on the effects of classical music on the sleep quality of Alzheimer's patients. I would like to thank Mr. Kane, my mentor, and Jack K for giving me this opportunity. I chose this topic after taking hospice class last year because during that class I volunteered at a hospice home where I worked with several patients with Alzheimer's, so I got to see firsthand some of the behavioral issues that they face. So today I'm going to be talking about a little bit of background on Alzheimer's and sleep. Then I'm going to talk about my research question, and then my method of study, my results, and finally the implications of my study. Alzheimer's is the most common form of dementia. It causes issues with memory, behavior, and cognitive function. Alzheimer's is a long-term disease that patients can live with for 4 to 20 years. Today, in the United States, over 5 million people are living with Alzheimer's, and that number is projected to grow as high as 16 million by 2050. In Hawaii alone, there are over 27,000 people over the age of 65 with Alzheimer's. Patients with Alzheimer's disease often show symptoms of anxiety, aggression, and depression. Music therapy has been shown to have very powerful and positive effects on Alzheimer's patients, especially with the late stages of the disease. A study done at the Lanspitali University Hospital showed that music therapy can cause a significant reduction in activity disturbances in participants. When symptoms of activity disturbances, aggression, and anxiety were measured, a significant reduction in the symptoms were shown in the group treated with music therapy. Along with symptoms of memory loss and aggression, Alzheimer's patients also experience sleep issues. Studies have shown that as many as 20% of people with Alzheimer's experience confusion, anxiety, and agitation beginning in the evening, known as sundowning. The evening agitation and sleep disturbances can prevent patients from having adequate amounts of sleep. Insufficient sleep can have detrimental effects and has been shown to cause obesity, diabetes, cardiovascular disease, immune system issues, and the common cold. Sleep quality has many factors, including time to fall asleep, total sleep duration, and number of wakings. Sleep disturbances, like the ones experienced by Alzheimer's patients, can decrease sleep quality by lengthening the time to fall asleep, shortening the total sleep duration, and increasing the number of wakings. Many studies have shown correlations between classical music and improved sleep. In a study, it was found that listening to 45 minutes of calming classical music before bed resulted in significantly better sleep quality in the participants. Despite the numerous studies on the effects of music on sleep and the effects of music on Alzheimer's patients, there is a gap in knowledge surrounding the effects of music on the sleep quality of Alzheimer's patients, and that's where my study comes in. So my research question is, can classical music improve the sleep quality of Alzheimer's patients? For my project, I recruited 4 participants from Manoa Cottage Kaimuki Care Home. All of my participants had a clinical diagnosis of Alzheimer's. I gave each participant a jawbone up move to measure their sleep each night for 5 weeks. I measured the participants' sleep for a week with no music as a control, and then for 4 weeks while they listened to music before bed as the experimental period. I had my participants listen to 45 minutes of slow classical music before bed each night during the experimental period. I put the jawbone sleep trackers on my participants each night between 5:30 and 6:30 p.m. and then took the trackers off the next morning between 9 and 10 a.m. I also had the nurses fill out sleep surveys about the participants' general sleep trends before the study at week 0 and then after the study at week 5. I didn't analyze the sleep surveys for the K Fellowship because my data collection ended too late to analyze all of the data. One change in my methods that occurred partway through my study was switching from headphones to speakers. About Oh, initially I was having my patients listen to the music with headphones, but after about a week, the nurses informed me that the patients were taking off the headphones and they suggested that I switch over to speakers, so I did. The jawbones that I used collected a wide variety of data from the patients, including sleep duration, sleep quality, time awake, number of wakings, time in bed, and more. But for the K Fellowship, I only analyzed sleep duration, and I'm going to continue to analyze the rest of my data throughout the school year during my independent research. So the results of my study showed that one of my 4 participants showed a statistically significant increase in sleep duration. The participants' total sleep duration increased from a mean of 7.46 hours during the control period to a mean of 9.91 hours during the experimental period. Although the rest of my patients did not show a statistically significant change in sleep duration, participant 3's increase in sleep duration was close to being statistically significant with a t-test value of p equals 0.0555. Participant 3's sleep increased from a mean of 8.54 hours during the control to a mean of 11.01 hours during the experimental. Through my research, I found that music can be used as a possible therapy to improve the sleep of Alzheimer's patients. Although it may not work for every patient, it has the potential to significantly improve their sleep quality. Improving the Alzheimer's patient's sleep quality will improve not only the patient's lives, but as well as the lives of their caregivers, because they won't have to deal with the sleep disturbances. I am hoping that my research will be able to positively impact the lives of Alzheimer's patients and the lives of their family and caregivers. I think that it's very important to care for the elderly in our society, and I hope that my study will be able to positively impact their lives. So I had a wonderful experience doing the K Fellowship, and I learned a lot. One of the things that I learned was patience, because I faced a lot of problems, both getting participants and getting my jawbones to work. My first set of jawbones were actually broken, so I had to restart my study after about 2 weeks of data collection. I also learned how much time and effort it takes to do a research project. For me, I had to go to Manoa Cottage every evening and most mornings every day for 5 weeks, even on the weekends. The only times that I didn't go was in the mornings when I didn't have a free period when Mr. Kane got my jawbones for me. I also gained a lot of experience working with both the nurses and the patients at Manoa Cottage. So this is just some advice that I have if you're considering doing the K Fellowship. So make sure you get started as early as possible during the summer, because you need to give yourself a lot of wiggle room, because some things take a lot longer. For example, I thought it was going to be quick and easy to get participants, but it ended up taking over a month to get anyone to sign up. Don't give up, because you're going to definitely reach some bumps in the road, and it might seem like your study's not working or you're not getting the data you expected, but if you keep pushing forward, it's going to work out in the end. But most importantly, have fun, because the K Fellowship is a unique and wonderful opportunity to learn more and do research on a topic that you're interested in. So I would like to thank Mr. Kane, my mentor, Dr. Chan, who also helped to mentor me, my parents for always supporting me and giving me a car to use, the nurses and staff at Manoa Cottage for their endless support throughout my project, and finally the John and Violet K Fellowship for giving me this opportunity. Thank you.
Hi everyone, thank you for coming. My name is Natalie Uhr, and I did my research on the microbial contamination in farm shrimp, specifically focusing on the prevalence of Vibrio parahemolyticus in Hawaii shrimp. So shrimp is the most commonly consumed seafood in the United States, with the average American eating roughly 4 pounds per year. And while I don't know the exact amount of shrimp each person eats in Hawaii each year, I'm expecting that it's much higher than the national average. And there's recently been a lot of concerns about the shrimp that we eat because 90% of it is imported farm shrimp. And this shrimp comes from a variety of countries, whether it's in like China, India, and many other places, mostly outside of the US. And there are many concerns about farm-raised shrimp being tainted with banned chemicals, containing animal hair, and also being subject to a variety of improper safety handling precautions. So it's, in general, like we don't know what the foreign standards that are set for raising farm shrimp. And a study by Consumer Reports actually found that 83% of the shrimp that we import to the US has Vibrio, Salmonella, Staph, or E. coli. So this is a really high percentage of all very dangerous bacteria. So it's important that we know what the levels of bacteria that there is in shrimp in Hawaii, and also what we can do to prevent ourselves from getting sick. So I chose to do this topic because we eat a lot of shrimp here in Hawaii, and we also have 2 local farms that produce their own shrimp. So I was wondering how our prevalence of bacteria compared to other places nationally and internationally. And I specifically chose to focus on Vibrio parahemolyticus because it's the leading cause of seafood-related illnesses in the United States, and it's responsible for 54% of all seafood-related illnesses. And there are approximately 30 cases of vibriosis, which is an illness caused by Vibrio, in Hawaii each year. While recently there's been an increase in the trend of infections, which suggests that there's a rising public health threat. And also, Hawaii is one of the 7 states with the highest incidence of Vibrio. Because we are a coastal state, we eat a lot of seafood, so we are naturally at a higher risk for illnesses caused by Vibrio. So Vibrio bacteria is naturally found at higher temperatures in marine and water environments, but there are some things that the shrimp farmers can do for prevention. They can monitor their water quality and change out the water when necessary, and also limit the number of shrimp in their ponds. And the Vibrio bacteria can also be spread in supermarkets and wet markets where the shrimp is being sold if the shrimp aren't kept chilled or if there's cross-contamination between different species. And the Vibrio parahemolyticus, there's 2 main strains of it. One is a pathogenic strain, which causes gastroenteritis, so basically stomach problems similar to food poisoning. And the other strain is a non-pathogenic form, which doesn't cause gastroenteritis, but can still cause other illnesses, so it is still a concern. So overall, my research question was, to what extent does shrimp in Hawaii pose a threat to public health? And I approached this question by first finding the rate of Vibrio parahemolyticus in Hawaii's shrimp, and then finding the rate of the pathogenic gene, which unfortunately I do not have the data for yet, but I'm still working on that. So as for methods, I started out collecting 50 different samples of shrimp, and these were collected from supermarkets and wet markets across the state. And from here, the samples were individually blended with an LB broth, which is a medium that supports bacterial growth. And then the samples were incubated overnight so that the bacteria could grow. And then the following day, I would extract the DNA. So basically, I would take a subsample of each sample, centrifuge the cells, boil the cells so that they would give out the DNA, and then take this DNA and run a PCR. And a PCR is a polymerase chain reaction, which you can design specific primers to look for the genetic code of a specific bacteria that you're looking for. And what it does is when it finds the genetic code you're looking for, if it does, it binds to the genetic code and replicates the DNA, so you end up with lots of copies of the bacterial DNA. And from here, I ran a gel electrophoresis, which allowed me to visualize my results. So a gel electrophoresis separates DNA fragments by size. So as you can see, some of the columns have like a black-red mark, whereas others don't. So in the ones that do have the black-red mark, it shows that there was the DNA fragment in the size I was looking for. And for the ones that don't have the mark, it shows that there wasn't. So this is how I visualize my results. And my findings were that 82% of the shrimp in Hawaii had Vibrio parahemolyticus, whereas only 18% didn't. So going back to my question of to what extent does shrimp in Hawaii pose a threat to public health, the rate of Vibrio parahemolyticus was 82%, so it is a significant threat to public health. And just to put this in context, a similar study about the shrimp in Malaysia found a 58% incidence, whereas a shrimp study in China found a 93% incidence. So it is on the higher side, but it is still in like the ballpark of numbers that most studies are finding. And it's also important to keep in mind that my research was done over the summer, so naturally this percentage is higher than it will be in the winter, but still we should be very careful when we prepare a shrimp, which I will talk about later. And the rate of the pathogenic gene is yet to be determined, but it is generally accepted that about 5 to 10% of the Vibrio parahemolyticus environmental strains of Vibrio parahemolyticus have the pathogenic gene. So my estimation is about 4 of my 50 shrimp will have the pathogenic gene. But regardless, it is still a concern for human health because, as I mentioned earlier, even the non-pathogenic Vibrio parahemolyticus can cause illnesses. And in addition, there are other bacteria that we should be careful for. Like I talked about in the Consumer Report study, they did find Salmonella, Staph, and E. coli. And there is the possibility of many other bacteria, such as antibiotic-resistant bacteria, because shrimp farmers often use antibiotics in their farming processes. There's a high probability that the bacteria in shrimp are resistant to antibiotics, and this essentially means that the bacteria are untreatable, which if we consume them, we can be left with illnesses that are essentially untreatable. And lastly, shrimp farms can also cause environmental damage by leaking the antibiotics, chemicals, and runoff into the surrounding areas. So you may be thinking that like this sounds really bad and you can't eat shrimp, but there is hope. If you prepare your shrimp properly, you can eliminate all bacteria and it's totally safe to eat. So the FDA recommends keeping your shrimp cold, like as I said, in the wet markets and supermarkets. Make sure you buy your shrimp from like an ice chest or from the freezer or refrigerator. And also, when you cook your shrimp, you should cook it to 145 degrees Fahrenheit, and that's the internal temperature. And making sure it reaches this temperature will make sure all bacteria, such as Vibrio, as well as other bacteria, are dead. And then once it's cooked, it should be kept either hot or on ice until consumption. So you still can eat shrimp, just make sure you prepare it well and keep it away from other things in your kitchen that it could cross-contaminate. And I would like to thank Dr. K and the K Fellowship for giving me this opportunity to dedicate my summer to do research, as well as Dr. Chan, who is my mentor in this project at Iolani School. Thank you. This was actually a challenge I had in my research because a lot of places don't know exactly where their shrimp is coming from. Like they don't know if it's even local or if it's imported. So I'm not sure about that. I suspect that some of it definitely was local, but I can't be sure.
Hannah, what was so difficult about getting the participants?
I think, well, initially they had the sign-up sheet just kind of in the front of the care home, and so I think a lot of people didn't really know what it was about. But then once I went back and talked to the people at the home, they sent out an email to all the families, and that's when I got people to sign up. I shouldn't. I technically wasn't supposed to know anything about the patients, like their names or anything, but because of the time I spent working with them, I actually got to know the patients as well as their families pretty well. I am planning on sending my paper and the results over, but I think I'm going to probably send them what I have now and then try to send them more as I continue to analyze the data.
I think the best part for me was I had a lot of problems like deciding exactly what I was going to focus on and the methods I was going to use. And then when I finally got it to all work out and like actually had results, like when the gel electrophoresis actually had results, it was really rewarding to see that like everything all worked out.
Yeah, I think I had so many problems throughout like my whole research that in the end, when even if one of my patients showed like significant increase in sleep, it was really rewarding.
When you switch from headphones to, based on what you did there, do you see the research going on with the use of speakers, or are you thinking in terms of anything else in terms of how that music can be given?
Well, for my study, definitely speakers worked a lot better because with the headphones, the patients would take them off. Like they wouldn't even listen to the whole music. They tended to take it off very quickly. But with the speakers, they are kind of forced to listen to the music. But yeah, if they didn't want to listen that night, then like they wouldn't have to. But I think the speakers definitely were much better.
Yeah.
Cooking to 145 degrees. After, is it like no longer wet, raw? I mean, how do you know? So shrimp tempura is out now, or?
No, that's fine. It's just they don't want like, you know how shrimp when you buy it, it's like often transparent looking. It should not be transparent at all anymore. So opaque.
Nice and red.
Yeah.
Overcook it rather than undercook.
Better than undercooking it.
Natalie, did this study change your own personal shrimp eating habits?
I think at first it did, but definitely back to usual habits now. Yeah, there's a shrimp farm on this island as well as an outer island.
Did you approach them in terms of?
I
see they might be sensitive about
Yeah,
this study.
I tried, and it was also hard because at least the shrimp farms here, like, they don't have like a distributor. Like, it seems like pretty arbitrary about where they sell to, so it's really hard to track down like samples of those to test. And I could never be sure if like the shrimp, like the person selling the shrimp, was trying to tell me that it like indeed was local, or they were just trying to make a sale. So it was really challenging in that part.
Maybe they were suspicious when you only wanted that one.
Yeah, it's also possible.
Both will continue your research this year?
Yeah.
Yeah.
Are you thinking of other kinds of music besides classical, or are you staying right with the classical?
Well, for my independent research class, I'm actually just analyzing all the data that I already have because I decided that rerunning the study would probably be a little bit too much to like get new patients and like rerun the whole thing. So I'm just gonna stick with analyzing the data that I already have.